Welcome back to my channel Knowledge Chronicle.
Have you ever wondered how a tiny virus can silently damage the most powerful defense system of our body, our immune system, and make even a common cold life-threatening? Today on Knowledge Chronicle, we are diving deep into one of the most feared and misunderstood diseases in modern medical history, AIDS. We'll explore what AIDS is, how it spreads, how it affects the human body, and most importantly, how to prevent it. By the end of this video, you'll not only have clarity on every aspect of AIDS, but you'll also be equipped to spread awareness, not stigma. Let's begin. The full form of AIDS is Acquired Immuno Deficiency Syndrome. Let's break it down. Acquired means it's not inherited or genetic. It's something a person gets during their lifetime. Immunodeficiency refers to the weakening of the body's immune system, and syndrome means a group of symptoms that appear together. So, AIDS is a condition in which the body's defense mechanism becomes so weak that it can't fight off even minor infections. And this condition is caused by a virus called HIV, Human Immunodeficiency Virus. HIV versus AIDS. What's the difference? It's important to know that HIV and AIDS are not the same. HIV is the virus that enters the body and slowly destroys the immune system. AIDS is the final stage of HIV infection, when the immune system is severely damaged and symptoms start to appear. You know, a person can live with HIV for years without showing any symptoms, but if it's left untreated, it eventually progresses to AIDS. AIDS was first reported way back in 1981, and over the past few decades, it has sadly claimed more than 25 million lives across the world. Now you might be wondering, how does HIV actually spread? Well, there are 4 primary ways. First, through unprotected sexual contact with an HIV-infected person. Second, through transfusion of contaminated blood or blood products. Third, by sharing infected needles or syringes, especially among drug users. And finally, from an infected mother to her baby during pregnancy, childbirth, or breastfeeding. So, who is at higher risk? People with multiple sexual partners, intravenous drug users who share needles, patients who receive frequent blood transfusions, like those suffering from thalassemia, leukemia, or hemophilia, and children born to HIV-positive mothers. But here's something equally important. HIV does not spread through physical contact like hugging, shaking hands, sharing utensils, or using the same toilet. It is not airborne and cannot be transmitted through sweat or saliva in normal circumstances. Now, let's understand what happens inside the body after HIV enters. Once inside, HIV first infects a type of white blood cell called a macrophage. Inside the macrophage, the virus uses an enzyme called reverse transcriptase to convert its RNA into DNA. This viral DNA then integrates into the host's genetic material and takes control of the cell, turning it into a factory that produces more viruses. Later, the virus targets another critical immune cell, the helper T lymphocyte or T helper cell. These T helper cells are essential for our immune system. HIV attacks and destroys them. As the number of these cells drops, the person's immune defense becomes weaker and weaker. Eventually, the body cannot fight off even simple infections. This is when a person is said to have developed AIDS. There's usually a time lag between HIV infection and the appearance of AIDS symptoms. This period can range from a few months to up to 10 years. Early symptoms include persistent fever, chronic diarrhea, sudden weight loss, night sweats, fatigue, and frequent infections that are hard to treat. Because the immune system is so weak, infections that would normally be harmless become deadly. These include bacterial infections like tuberculosis, fungal infections like candidiasis, viral infections like herpes, and even parasitic infections like toxoplasmosis. How is AIDS diagnosed? The most common test for HIV is the ELISA, enzyme-linked immunosorbent assay. It detects the presence of antibodies against HIV in the blood. If the test is positive, it's usually followed by confirmatory tests like the Western blot. Can AIDS be cured? Unfortunately, there is no complete cure for AIDS, but there is treatment. Antiretroviral therapy, or ART, involves a combination of drugs that suppress the replication of the virus. While RT doesn't remove HIV from the body, it significantly reduces the viral load, delays the progression to AIDS, and allows people to live longer and healthier lives. But remember, these drugs are lifelong and require strict adherence. So, when it comes to the prevention of AIDS, it's super important because, well, there is no cure yet. That means prevention really becomes the most important strategy. Here's how we can prevent HIV: practice safe sex. Always use condoms. Avoid sharing needles or syringes. Make sure blood transfusions are done only with screened, HIV-free blood. Pregnant women should get tested and treated to avoid mother-to-child transmission, and, get regular checkups if you're in a high-risk group. In India, the National AIDS Control Organization, or NACO, along with various NGOs, have been working hard to spread awareness and provide access to testing and treatment. On a global level, the World Health Organization has launched programs to promote HIV education, safe blood practices, and safe sex. One of the biggest challenges in fighting AIDS is social stigma. People living with HIV or AIDS are often treated as outcasts, and honestly, this fear forces many to hide their condition, which just increases the risk of unknowingly spreading the virus. It's crucial to understand that HIV-positive individuals need support, not isolation. The virus spreads through behavior, not presence. By isolating people, we actually make the situation worse. It's not just a medical issue, it's a societal responsibility. AIDS is more than just a disease. It is a wake-up call. A call to educate ourselves, change harmful behaviors, break the silence, and stop the spread. We have the knowledge. We have the tools. Now, what we need is awareness, empathy, and action. If this video helped you understand even a little more about AIDS, share it with someone. Because, every share might just save a life. Your one like, share, and subscribe will help us create more valuable content.